Hi everyone, welcome back to my channel. It's Shayna here. I'm just wanting to give you another update, another weekly pregnancy update of 36 weeks. So currently I am 36 weeks and 3 days. So I'm almost at 37 weeks, which is almost full term. So I want to discuss with my symptoms. I'm going to get in more depth with my symptoms like I didn't in my last video. Just because I did go over it, like most of my symptoms that I've been feeling. My second video, my 17 to I guess 16 or week update. I apologize for how I look. I am kind of in the middle of cleaning my house and whatnot, but I want to get this video up before I get too busy and whatnot. So if you see little hairs up here popping up, don't mind that. It's just my hair. If you hear my washer running, I'm cleaning out my washer right now, and I have two cats sitting here, so don't mind any distractions here today. Um, we'll get right into it. So currently I'm 36 weeks, but I'm gonna go over my previous week. So from 35 to 36 weeks here. So I had backaches throughout most of my this week. That also kind of played into some other symptoms here. I'll kind of explain more in depth. I had pelvic discomfort, so just lots of pressure in my pelvics. It was, I think, just baby getting lower and stuff like that. I had Braxton Hicks contractions, but I had a mix between actual contractions and Braxton Hicks. People say that Braxton Hicks can be very, very painful, but and then there's other people that say no, it just should be your stomach tightening. Sometimes you won't even notice it. But I kind of had a mixture of both. So with my Braxton Hicks, when I did have Braxton Hicks, I could feel my stomach tighten, and it wasn't painful. It was just like, oh, yeah, feels like your stomach is tightened, which I'm having one right now. But with the ones that I had, the actual contractions, it felt like menstrual cramps, and it started from the very back, like my back, and wrapped around my stomach, and it got really painful at one point where I thought maybe I was going into labor, but I wasn't. Um, and I let my doctor know about that at my 36-week appointment, just letting her know that that's what I was feeling, and she's like, okay, yeah, we'll check you out. So she wanted to check me out, of course, and stuff like that, just because um, with those, like with more painful menstrual cramps. Like I did at 35, my 34-week appointment, I did have the same thing, and I let her know that, but it was very, very dull. It was like, it wasn't like concerning. It wasn't very painful at all, but these ones have been very painful and like for a long time, like a minute long and stuff like that. And I did track them, but they weren't very consistent. So she just wanted to check my cervix to see what was going on. Um, so there's that. I'll get more into my appointment though, what we discussed in my appointment, because there was a lot of information that I got. So I had Braxton Hicks contractions and a mixture of actual contractions, of course exhaustion. I haven't been able to sleep for some odd reason. I'm so tired by 10:30 at night, but I can't sleep until like 3:30 in the morning, and then I get up at 6 a.m. Like I can't sleep, which really sucks. My fiance is gone out of town right now, so I have the bed to myself, which was also very nerve wracking because if I go into labor, he's not here. But I have a backup plan. I had cramping, like I said, menstrual like cramps, swelling. I'll also get more into depth with that in the appointment that I had. But I had swelling my feet, swelling my hands, of course. That also has to do with the heat that I have here. Um, Insomnia, which I discussed already. Sorry, I'm just looking at my notes. Frequent urination, just because of how low baby is just all the time, no matter what. Even if I have to pee a little bit, not even that much, it just feels like I have to pee. Nipple soreness, my irritation of the nipples, but I think it's just getting ready for breastfeeding. Shortness of breath, I think that might be just allergies for myself, but I still have shortness of breath. I have gas, lots of gas, all the time. I have constipation, and I feel like sometimes I just can't go, but then when I do go, it's kind of like more of a mixture between diarrhea and constipation. Like it's just very out of the blue, and this might be a little bit TMI. And then I have discharge, but I've had discharge, like increased discharge throughout my entire pregnancy. I don't feel like it's gotten in, like I don't feel like it's gotten a lot more recently because I'm trying to look out for the mucus plug too. But feel like it's just I have to wear panty liner, so I just wear panty liner if I'm going out in public and stuff like that. But other than that, that's it. Leg cramps, of course. I get them in my legs when I stretch out in the morning, and I try not to stretch out too much because it hurts. Um, Migraine, I had a really, 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 really bad migraine. I haven't had a really bad migraine since I was in my second trimester, and or really much of any headaches. And all of a sudden, a couple days ago, I had a really bad migraine, and I'll get more into that in my my next section that I have to talk about. I had a lot of stuff happen this week. I still have no stretch marks, so that's a plus. So that's all the symptoms I've had, plus whatever I had in my 35-week update is just added more. I don't know if this is all was in there, what was up, but that was about what I had to. So I'll talk now about my appointment. So when I had my appointment, I had really, really bad anxiety. My fiance just left for work out of town, so he's been with me throughout this entire pregnancy up until now. So it was just anxiety of him leaving, with how far along I was, with getting lots of cramping while he was here. So I think it was just anxiety that had high blood pressure, but I also had lots of swelling. So when I went to go get checked, they noticed that I was retaining fluid and stuff like that. So retaining water. So they wanted to check my blood pressure, and they noticed it was high, so they wanted me to go for a blood test and urine sample, and everything turned out. Blood test came out fine. I had a little bit of protein in my urine, but it wasn't enough to concern her. So there's that. And then she checked it again when I walked into the doctor checked it for me again 10 minutes later into the appointment, and she said it went down, but it's still a little bit high, so she wants me to check my blood pressure throughout this weekend, which is fine. I think it's just anxiety, so I'm not too worried about it. And then she noticed that baby is well engaged, so that is why I'm having a lot of discomfort, pelvic discomfort. Baby's been really low this entire pregnancy, but baby is already, like, baby dropped, which is nice, but it's very difficult to say, and that's why I was so concerned about these contractions, because I was like, baby's already low, and I'm having, like, baby's well engaged, and I'm already having contractions, like, am I going to go into labor early? But she checked my cervix, and she said that it was thick and firm, and she had a hard time getting into my cervix, like, checking it, because baby's head was already super low. So baby's head is like, this is where my cervix is, or this is where the cervix is, like, the vaginal opening is, like, right here. Baby's head is already, like, here, and my cervix is, like, behind baby's head. So she had a hard time getting behind baby's head to check. So my cervix was posterior or something like that, and it, like, climbs down as baby gets lower, and that's when you can tell if it's dilating or not. But I wasn't sure if I was dilating. She said she couldn't tell if I was dilating, but she said that from the feel of it, it's still thick and firm, so it's still a little ways to go to thin out and stuff like that. Which I then bought raspberry leaf tea and had 1 cup of it, and I researched it and stuff like that, and they say that you can start taking it at 32 weeks. So I was like, okay, well, obviously it's safe to take. So I was taking some and stuff like that. I had 1 cup, just one dosage, because they say that you have to ease your body into it. And so I only had 1 cup. And all of a sudden, like an hour later, my eyes started bugging me, and so I wasn't feeling it. So I went to go lay down, and this is 2 days ago. And so when I went for my nap and I woke up, I had such a bad migraine, I couldn't see. And so it got to the point where my fiance actually drove me into the hospital. So I went for a hospital visit this week to check to make sure everything was okay. I wasn't sure what it was from. I wasn't sure if it was from the raspberry leaf tea, but I had a funny feeling it was. And I wasn't sure what was going on with me. I want to make sure baby's okay, so he rushed me into the hospital at like 8:30 at night, and we were there. We didn't get home till about midnight. Everything was good though. Baby was fine. I'm okay. They took some more blood work. They took another urine sample. They checked my blood pressure. They noticed everything was normal and stuff like that. So they sent me home. Gave me some Tylenol, because I wasn't sure. I know Tylenol is safe for pregnancy, but I wasn't sure if it was gonna affect my blood pressure even more. So I didn't want to take it in case and cause even more problems. So I didn't take it until I got there, and they gave me some to calm it down. So it's been helping quite a bit. Then yesterday, I just relaxed for the day. I was going to do a whole bunch of house stuff, but I didn't want to come back since my fiance was leaving, yet did leave back out of town yesterday, so I didn't want to provoke anything, so I didn't. I just relaxed for the day, but today I'm doing stuff. Um, so there's that. So I don't know what to do. I'm planning on I'm not taking raspberry leaf um, tea anymore. I don't want to risk it. Um, I did buy pineapple. I've heard that's supposed to soften your cervix, but you have to eat a lot of it. I also like the taste of it, and it's not bad to take in pregnancy as far as I know. So um, I bought some just because I do like it, and if it helps, it helps. But the raspberry leaf tea, like there's people like it's supposed to help soften your cervix, supposed to prepare your body for labor and stuff like that, and like do your research and everything. I found out that you're not supposed to take it when you have high blood pressure, and I didn't know that. I should have done a lot more research into it, but I didn't. So before you take it, do a lot of more research into anything, especially like talk to your doctor about it. I didn't, which was a mistake for me. So but definitely talk to your doctor about it before you take anything to try to soften your cervix, to try to induce labor, anything like that. Um, just a disclaimer there. I did ask her about taking evening primrose oil because I had friends tell me that it's supposed to soften your cervix and it's supposed to thin it out. And I know that I'm going to get crap for this, but I do want to have my baby early. Not early, but early enough. My brother is having his wedding a couple of weeks, supposed to be a couple of weeks after my due date. And I just want time to heal. I know that may seem selfish, but um, it's my life, it's my body, it's my baby. So I will do what I want to do. But I'm not going to start taking the evening primrose oil until I am 37 weeks. Like my doctor said, I asked her if it was okay, and she said, "Yeah, but I don't recommend taking it till 37 weeks." And with how low baby is, she said that once I do enter into labor, may not be active labor, but it's pre-labor. She said that it's going to go by fast, especially with how low baby is. So she doesn't want me taking it till 37 weeks. Because once my cervix starts softening and thinning out and dilating, it's not going to take very long for baby to be here. So she doesn't want me taking that until 37 weeks, which I totally understand, and I'm okay with that because baby's not going to be full term by then until then, and then baby might show up at 38 weeks or 39 weeks, who knows, and maybe my fiance will be back by then, hopefully. So there's that. But I did double check with her to make sure everything was okay. She noticed that I did have, like I said, high blood pressure, so she wanted me to be checking it over the weekend. Just because she doesn't know, like my mom has a history of hypertension with her and toxemia or toxmosis or something with her. Oops, sorry, my eye. With her like with her pregnancies. With my oldest brother, he was 2 months premature, and with my second brother, she had it with all of us kids. So she gained lots of weight, and I've gained quite a bit of weight throughout this pregnancy. It doesn't seem like it because I seem fairly small for how far along I am, but I've gained weight in other places, like I said in my previous update. So she wanted to keep an eye on that too. But I don't think I have it. I think it's just I'm retaining water because of the heat and whatnot. So I'm trying to do my very best not to do that. I'm trying to be drinking lots of water, but keep my fluid count up and stuff like that, but trying to reduce the swelling as well. But now I'll talk about the size of baby this week. So size, baby is the size of papaya. So 17.2 to 18.7 inches. And weighs about 4.2 to 5.8 pounds. So that's quite fairly big. I did have an ultrasound previously because she checked my, I don't know what's called, fundamental height, the measurement from your pelvic bone to the top of your uterus. She noticed that it was kind of low, so she was kind of a little bit concerned of baby's growth, to see if baby was too small or was growing smaller. But she did give me a call back, so I did have an ultrasound. She gave me a call back, and she said, no, baby looks good, so she's not concerned about that anymore. I think I'm just small because of how low baby is and how low baby's been this entire time. So she's not too concerned about that, so that's a good thing. I'm hoping I'm right along track, but I guess I'll talk to her about that at my 37-week appointment, which is next week, sometime in a couple of days. So I'll also give you guys an update then too, to see what happens. I had lots to talk about today. There's lots of stuff that was happening this week, so yeah. Keep an eye out for my next couple videos. I'm planning on doing like a little baby haul. I'm gonna try to do I'm gonna hopefully have my hospital bag packed up by the end of this weekend. So by the time I am 37 weeks, it's ready to go just in case anything happens. Because anything can happen, of course. Anything can happen now. Anything is okay, somewhat okay to happen at 37 weeks. So I'll hopefully have my hospital bag packed by then, and baby's bag and my fiance's bag. I won't show what's happening in my fiance's bag just because it's pretty basic, but my baby's bag and my hospital bag, of course. Comment down below if there's anything else I'm missing. I tried being a little bit more in-depth TMI with this channel, with this video, sorry. I'm not going to hold anything back on my videos. It's going to be straight up honest, so if you don't like it, don't have to watch it. If, like, there's going to be times where it's too much information and that kind of thing, but that's pregnancy. That's what happens. So, yeah. I will show you my belly shot really quick. Alright, so this is my belly from the side. From the front. Don't mind my cats over here. From the front. This side here. There. 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 Thank you for watching. Hit that subscribe button. Comment down below. I'm going to have hopefully a couple more videos coming up here. And yeah, let me know what you guys want to see. Thank you for watching.